This video is part 2 of Frankie and Alice, my discussion for PSY 300, Movies and Madness. Before I dive into the details of the film with the questions that I asked you to reflect on this week, I will say Frankie and Alice is not a perfect film. It may not even be a great film. Some critics were very fond of Halle Berry's performance and very complimentary of the work that she did, but simultaneously they tended to be very critical of the plot and the writing. That said, what my focus in this class is not necessarily on the quality of the film as film, but in terms of the way in which the film communicates messages about people with mental illness. One other reason I chose this film for you, in addition to the fact that it's a relatively accurate portrayal of dissociative identity disorder in comparison to other films in the genre, it's quite accurate. But it's rare in this genre of films to have lead characters who are people of color, and it's also not as common. Although some of the famous examples of DID films are of female characters, in recent years it's more common for these characters to be male and to be particularly violent. So I kind of wanted to get away from that in the film that I chose for you. So with those opening comments in mind, I asked you to think about your initial impressions of Frankie, again played by Halle Berry. And she's presented to you as a very 70s urban go-go dancer slash stripper from that vintage era, complete with gigantic earrings. So she seems to be really into her job, very good at her job, and very much a creature of that urban lifestyle in the 1970s. Right away, though, you start to see that she is experiencing some fear episodes, some episodes where she appears to have dramatic shifts in behavior and dramatic shifts in her emotionality, mostly, trending in the direction of being very confused, having disturbances of her conscious awareness of her surroundings, and also appears to be on the edge of panic at times. So you see her behavior is moving in one direction, such as wanting to have a sexual interaction with the bartender, but then becoming combative and terrified in the same situation. And then later, appearing to wake up in a place where she doesn't recall being. So we see that she appears to be having these experiences that we later put together as evidence of dissociation. Now, I asked you in your reflections as you were watching, what is dissociative identity disorder? And then I asked you to think about Frankie's transition to Alice in the film. And, for film critics, when they evaluated the film for future viewers, one of their concerns about the film, and this criticism came from film reviewers, both white film reviewers and film reviewers who are people of color, particularly African American reviewers. There were concerns about, what does it mean to have a film where a black woman is shown transitioning to what was described in the press at the time on the film, an antebellum Southern white woman who is quite racist and fairly elitist. And so there was some, concern on the part of film reviewers that this was in some ways overtly racist in the way the story was told. I think the writers were in a quandary. The story is based on a real life person, and that was the nature of her experience. So they were kind of bound by those story elements for film viewers, for viewers especially given our current context, that can be a very uncomfortable thing to see. The transition, and one of the things that mental health professionals, those who are experts on dissociative disorders, really were appreciative of, though, in this film, was the fact that the way Halle Berry approached these transitions in personality was authentic to their eye. You know, people who have treated individuals with DID and people who have experienced DID themselves tended to see Halle Berry's presentation of the transformation between the two alters of Alice and Frankie to be authentic. So you see that there's usually some sort of traumatic trigger where her Frankie identity is stressed and under threat, and that tends to be when the alter character of Alice appears. She changes her demeanor, she changes her hair, she changes the way she talks, the way she moves across a room, all of those elements. You don't have some of the over-the-top ways in which film directors often present these transformations, but it is vivid enough that you know clearly this is presenting as another person. Now the film introduces you to Dr. Oswald, played by Stellan Skarsgård. He is shown to you as one of those, if you remember, I gave you some categories of mental health professionals, particularly psychologists or psychiatrists in film, how there's often a Dr. Wonderful. Dr. Oswald in this film is pretty much in that mold of the Dr. Wonderful character. He's dedicated, he's pretty fearless, he's very committed to figuring out the mystery that is Frankie. He is shown having conflicts with the other doctors who are dubious about his interpretation of what's going on with Frankie. They are shown having a close doctor-patient relationship, but there isn't evidence of line crossing where he appears to be breaking rules or showing what often happens in films of this kind, where they would be shown having a personal friendship or some sort of boundary crossing relationship that involves Dr. Oswald violating ethics. There doesn't appear to be any of that in this film. So, but what you do get is, for the time period in which the film is set, a fairly authentic, although probably him spending more personal time with one individual patient, but it's a pretty authentic way of showing how he would go about trying to document a case of this kind by keeping careful notes and records and attempting to walk her through this process of growing awareness of what's going on with her. Now, of course, it is dramatized. You're given, in Stellan Skarsgård's performance, he is a kind of classic Dr. Wonderful. He's very caring. He runs into opposition and he fights back, and he pretty tirelessly attempts to help his patient. The alter personalities that you're given, you're provided with 3, and the director provides you with some help here in the form of Dr. Oz putting his notes on a chalkboard, and that's clearly, you know, the director wants you to have some notes to be able to look to visually to tell the difference between the alters. And I find it interesting that in this film you have the chalkboard disclosure. In another film it's not a straight up DID story, it's more of a convoluted set of an amalgam of psychiatric problems, but in Shutter Island you have a similar kind of chalkboard moment between a doctor and a patient trying to explain who you are to the patient. So he he shares with Frankie these three characters and their different characteristics. What you see there is that you have a bright person with a variety of physical characteristics, but also some deviations in how they behave. And what he's trying to document there is, some of the uniquenesses across these personalities. You have Frankie at her as the core personality, Genius as the child personality, and Alice as the older white female from an earlier point in time. The child appears to be the character that is given more knowledge, more awareness of what's going on in terms of secrets. So one pitfall that the writers have kind of fallen into is the idea that there needs to be an ultra character that has the secret, and that once the secret is uncovered, then the real path to healing can go forward. And I will say that this is based on a true story. I have had a tremendous amount of difficulty tracking down the elements of the true story. So it's hard to say whether the writers of the film have added some of these embellishments because they create a story that would make sense to the audience, or because they were actually true. So the trauma that slowly unfolds in the film is that you have Frankie as a young woman, as a teenager, has had a sexual relationship with a white man in the house where her mother worked, and she has become pregnant and has had to flee. She has the baby, and her mother murders the baby. And this trauma of giving birth as a child and then having your baby murdered by your own mother is an overwhelming trauma for a very young person. The suggestion in the film is that this is the trauma that has caused her identity to fragment into these pieces. Now, I did mention that there are some disagreements between the doctors about what's going on with Frankie, and you do see some of these very interesting but unexplored moments in the film. And there was some criticism of the film that race really wasn't dealt with in the film, but it was a constant presence. In some ways, you get very classic, not very well unpacked images of a psychiatric hospital. So you've got the day room, you've got the constant smoking, you have the games, the cards, you have orderlies in white uniforms, you have moments where Frankie, as the main character, explodes and has to be restrained in a straitjacket and medicated forcibly. Those are pretty standard, psychiatric hospital scenes that you've seen several of now in this class already. The conflicts seem to be driven, and this is a point in the plot that could have been made more explicit, but were not. But you have some tendency on the part of the other doctors, not Dr. Oz, but to see her as a rebellious black woman who is likely abusing drugs, and the drug abuse is likely the cause of her problems. Whereas Dr. Oz is looking deeper and attempting to find a psychodynamic explanation in the form of childhood trauma. Now, I asked you the question, what role do the racial and class dynamics of the 50s, so the trauma occurs in the 50s for Frankie. The film is set in the 70s. So, what are the race and class dynamics? You have a very upper class white family. You have black employees in the home. It's also depicted as Southern. So you have these dynamics, and a critical viewer, you'll notice a lot of these little tiny hints and clues. But at the center of it is a Romeo and Juliet kind of romance between the white son in the home and Frankie, and it is a love match. They intend to run away together, but tragedy ensues. Frankie is pregnant, and as we discover, the big plot reveal is that Frankie's mother has murdered her mixed race child, for reasons that aren't really unpackaged for you, and you're kind of left to deal with that. Now, as I mentioned earlier, there was a lot of, not a lot, there was some statements in the reviews written by film reviewers at the time the movie came out, that they were concerned about the message being sent by having this woman in her 30s who's a black go-go dancer who manifests as a Southern white woman in her style, in her interaction, and that caricature was very problematic. I believe that it's one of the things that could have been improved in the film, is to really kind of work through what would be the added dimensions of the traumatic experience to having this forbidden love affair be between a white man and a black woman who is, at the time, younger than him, significantly younger than him, and how that would just magnify the trauma of the loss that she suffered. Now, as I always do, I ask you to rate the film in terms of stigma impact. It's hard not to get distracted by the potential ways in which you could spend time really thinking about the race messages. And I find myself, in fact, getting kind of tangled up in that. If we were talking about positive and negative messaging in our current climate about film depictions of people of color, we could have an entirely different and very long discussion of that. When I try to separate out what are the positives and negatives of messages about mental illness in this film, I tend to lean in the more positive direction. The depiction of DID is pretty straightforward and fairly accurate. You don't have a casted character being presented as an alter personality. You have, based on the case studies that we have available to us, a fairly authentic presentation of a person struggling with the memory problems, the panic episodes, and the overwhelming anxiety that can come with these dissociative experiences, and just the basic confusion that one can experience because of them. So on that score, I see some positives. Now, are you going to learn a tremendous amount, clinically speaking, from this film? Probably not. But at the very least, what you have is a sympathetic portrayal of a person struggling with DID who has a positive interaction with a clinician who cares about finding out what's going on with her, and who appears to be moving in a positive direction in terms of taking control of her life. Is there a little bit too much emphasis on her mother being to blame? Yes. That's one stereotype that is ubiquitous in this genre of films, where the cause of the dissociative splitting is often placed squarely on the shoulders of the mother. Whether or not it was true in this real person's story, we tend to be very fond of mother-blaming narratives for characters with mental illness, particularly when the characters have split identity issues. So I'm going to conclude there. That's the end of part 2 of my coverage of Frankie and Alice.